Hi, I'm Jonah Comstock, Editor-in-Chief of pharmaphorum. I'm here at Bio 2025, and I'm joined by Juergen Eckhardt, VP at Bayer. Why don't you say your full title so I don't get it wrong?
Yes, hi Jonah. I'm Juergen Eckhardt and I'm the Executive Vice President at Bayer. I have two roles. One is I'm leading the business development and licensing organization for the pharma division. And I'm also head of LEAPS, the impact investment arm of Bayer.
So let's talk about your BD role first, because that's sort of the main reason you're here at Bio. What are you on the lookout for? What are kind of the top priorities for Bayer right now in terms of business development?
Sure. So first of all, external innovation is super important for us, I guess, for any pharma company, right? Many of today's FDA-approved drugs have originally been sourced from academic groups or from smaller biotech companies. And I guess that's why we are all here, right? Because this is a great place where we can meet many innovators from around the world. Our priorities at Bayer Pharma are really to partner at the early stages. Most of what we do is sort of between preclinical proof of concept and phase 1 data. And we are focused on several therapeutic areas. One is oncology, which is one of our key focus areas. Second one is cardiovascular, metabolic, and renal diseases. Thirdly is inflammation and immunology. And then we also have a strong presence in women's health and in ophthalmology. So in those two areas, we're also meeting with many innovators and companies here in Boston.
You said you're looking in the early stages. That's interesting. I know a lot of the big pharmas are often more inclined to look for later stage, lower risk. What's the rationale behind sort of trying to get in early, and how do you deal with that risk tolerance?
Yeah, so we strongly believe that the smartest time to partner is at the early stages because you are able then to sort of co-shape the development of the asset in the best possible way, right? And you are really able to partner with the innovator at that stage in the best possible way. I'm not so sure about the other pharma companies, how they think about it, but I would also say there may be a little bit of public bias because what fetches the headlines is usually these big late stage deals with the big figures attached to it. But I personally think the bulk of when partnering is happening is at the early stages. So for example, last year we did about 20 or so transactions in BD. And many of those didn't really hit make the headlines, right? But we believe it's the sweet spot for partnering.
Any examples you can talk about right now that are public, recent deals that you're excited about?
Absolutely. So in March this year, we announced a partnership with Pue Biopharma, a Chinese biotech company, and we partnered one of their oncology assets at the early stages, as we said. And that's really an interesting deal because it shows how innovation is happening across the globe, right? And we, of course, have a presence across the globe. My BD team, for example, is spread between California and Japan. So we have feet on the ground in all ecosystems of this world, innovation ecosystems of this world, and we are sourcing innovation from wherever it comes. Another feature, maybe that it's worth mentioning here is we have the CoLab, the Bayer CoLab initiative. You may have heard about that. So we have these Bayer CoLabs in those ecosystems in Boston, in Berlin, in Shanghai, and also in Japan. And that's another way how we try to be part of that ecosystem, how we try to partner earlier stage with these innovators. And we're not just providing office or lab space, but it really comes with a lot of coaching and mentoring from our experts, our drug development, drug discovery experts. So it's another way to be plugged into the innovation ecosystem.
We were talking earlier, trying to remember where we'd met before, and actually it was the opening of the CoLab in Boston. That's what it was.
Oh, yeah, great.
So you also have this role with LEAPS. So how is that different than your other role? What are you doing with LEAPS that isn't just sort of like early stage partnering and encouraging innovation?
Yes, so the role of LEAPS is really to go really early. So with LEAPS, we have made a lot of investments in early stage technology platforms. at the stage before these technology platforms are maybe ripe enough for our divisions to partner with them, right? So we start with a minority equity investment to help develop these platforms with capital, but also with know-how wherever our know-how is applicable. And then we try to follow the development of these platforms. And once they've developed to a certain stage that they become attractive for our divisions to really bolster their technology platform or help renew their technology platform, then we can double down with a second transaction, which could be a licensing at that point, or which could be an acquisition. And maybe just to give you an example, right? One of the companies that we actually co-created as Leaps was BlueRock, a company focused on the potential of the induced pluripotent stem cell. We co-created this company back in 2016, and it remained a Leaps portfolio company for about 3 years until it was ripe enough for our pharma division to really get interested and excited about it. And in 2019, we then fully acquired BlueRock. And today it is a 100% subsidiary of Bayer Pharma. And maybe another interesting feature is we never fully integrated BlueRock into our pharma R&D organization, but we remained, we kept BlueRock to this day sort of as a so-called arm's length company. So it's a separated unit from Bayer Pharma. We are managing it through a board of directors, just as any other independent biotech company would be managed. And through that, we were able to keep that innovation powerhouse as it is and as it was when we acquired it. And BlueRock has just developed in a phenomenal way. We announced early this year that we completed phase 1 trial and that we are now in preparations for launching a phase 3 trial in the foreseeable future.
That's great. I think we're probably running close to time. So in your position, it just occurs to me that you're probably seeing so much of the early innovation, the different kind of big bets that these smaller companies are taking. What's one therapeutic area or technology trend that you feel like the industry is kind of sleeping on right now? Do you think it's going to be big?
I'm not sure anyone is sleeping on any of those, but there are several things that really are exciting, right? I mean, oncology has seen a lot of progress over the last decade or a little bit more, and I think we're going to see a lot of progress in areas like neurodegenerative diseases, and also in inflammation and immunology. We're going to see a lot of progress. All helped, of course, by AI and machine learning, right, which is coming big into biotech and into pharma. So I think we're living in an exciting time, and I think we will see a lot of progress for patients in need of new therapies.
Thank you so much for chatting with me, Juergen. Really appreciate it and enjoy the show.
It was a pleasure meeting you and catching up with you, Jonah.